welcome to Unraveling the Brain. I'm your host, Dr. Josh Madsen. Today I got a special treat. We got a friend from Chile. He owns the Brain Treatment Center of Chile, and we are going to be talking about everything from brain rehab stuff that we do, that they do, also parenting aspects that play into this, that, you know, with a background with working with their clinics, different things that they have found to be helpful for helping a lot of kids as well. So it's going to be really fun of taking two different clinics that work with kids on neurological rehab, but from two different aspects or two different areas of expertise. And we're going to chat all about that today, and super excited for this talk, and let's jump into it. Welcome.
Thank you. Thank you for having me. Thank you for inviting me.
You're welcome. Well, we're excited to do this. So give a little background on yourself first and foremost, because that's usually people want to understand who's talking, and give your experience and your different coaching experience, but then also you guys opened a rehab center, and explain that a little bit too.
Yeah, absolutely. So my name is Mikael Gayme. I'm half French, half Chilean, and I've been living in Chile for many years now. My background is as an engineer, and I also participated in 2 Olympic Games as an athlete. And then as life turned on, I have a son in the spectrum, Noah. He's 14 years old. He's the one that came here for a 2 weeks intensive here at Infinity. And in this road that we've had with autism, what has been really helpful is meeting other families. They've been really generous. They've been telling us, hey, this worked for us, this we tried. And eventually we started going to Florida to therapies on intensive as well, like 5 hours of therapy per day in intensives of 3 weeks, 6 weeks, and 9 weeks. And we met some families there that we saw the progress, and we told them, like, guys, what are you guys doing while we were not here? And they told us about transcranial magnetic stimulation, MeRT. And we went there to Los Angeles, and we started doing both. And eventually, at some point, we managed to open up a clinic in Chile, the first in South America, to have this synchronized transcranial magnetic stimulation.
Awesome.
And we've seen great results for our son and for other families.
Yep.
And we implemented that with what I think today is the most profound and the first thing that I have to do to help my child in the spectrum, which is for him to be okay, I have to be okay as a parent.
Yeah. Yep.
And many of the parents that come to us, like they say, help him. He's the one that's got the difficulties, that's got the problem.
Yeah.
And I don't think that they are aware enough of how much they influence that possibility of the child.
Yeah, for sure. And the expectations they put on them of, like you hear this, and I see this like from the provider side of like, oh yeah, we went to this specialist and they said they'll never do this. They said they'll never do this. And if the parent, if they perceive like, oh yeah, my kid will never do that, well, like they're putting that expectation on the kid where, I almost never find that to be true. And then when I tell them, oh, they are going to do this, and they do, they start to change dramatically. A lot of times it's the parent's perspective has changed of like, oh, that is possible. And so I think that goes right along with what we're going to talk about today, of talking about especially from a parenting aspect here of different things, different tools, which I'm really excited to get your insight on, of things that you guys have done, of different things that you can do to help coach the parent first and foremost. So let's jump into that.
Yeah, absolutely. As you were talking, I was just thinking of something that happened with my own son, with Noah. At some point, we had to work on him for his independence,
Yep.
And he was working on putting on his socks, and it would take him 45 minutes.
Yep.
And I'm like, I don't know if I have that much time just for the socks. What are we going to do with all the rest?
Yep.
And eventually, he proved me that he was able to do that and much more.
Yeah.
And eventually, we change our way of seeing that as parents. And today at our clinic, we have a lemma, which is, I'm going to get far, Dad. I'm going to get pretty far. Just give me some time.
Yep.
And that's what this is about. This is about giving them the time so that they move forward, and especially focusing on the areas that we need them to work on before we move to the next one.
Yep.
So one thing that we learned, for example, is why should we learn on try to get him skills like trying to talk more, trying to do other things if we haven't gotten his self-regulation first?
Correct.
So what we're doing as parents and in our clinics is being really, really disciplined about not getting anxious and knowing we're going to work on this until this is done so we can move to the other one.
Yeah.
Because if not, we're kind of building a castle in the air, you know?
Yep.
And eventually it will crumble.
Right.
It will fall down.
It's the same principles of like, we see kids that, let's say they have a reading delay. Well, foundational for that is they have to be able to track their eyes. Foundational for that is they have to have a balance system. Foundational for that is they can't have primitive reflexes. And we always jump to a big challenge here, which I get it, is we always jump to, we want them to do this skill, but it's such a high level skill, and there's so many foundational pieces underneath that.
Exactly. So we started doing our programs with Noah, so his therapies, and we started having our coaching sessions. We did sessions with other dads. So dad sessions and mom sessions are not exactly the same, right?
Yeah, for sure.
Then we had our own sessions, like me with the coach, my wife with the coach, and then we have couple sessions.
Yeah.
What's going on with you as a couple?
Yep.
What's going on with you by the fact of having a child on the spectrum? How is it affecting you?
Yeah.
And how is that affecting your parenting skills so that you can help him the best?
Yeah, for sure.
And that's what we're working at the same time. So with the transcranial magnetic stimulation MeRT, we're helping that brain being the best at it can, helping them take it to the next level. And then how are you adapting your parenting skills to take advantage of this new brain?
For sure.
And to give them all the possibilities. We have some parents that come there, kids are 7 years old, and they still have him in a stroller or giving him the bib like a baby.
Yeah.
And we're like, that's holding them back so much.
For sure.
You're maybe not aware of that. And sometimes also, we're helping them like, how do I communicate with my son? How do we make sure that he's understanding? Because he's nonverbal, they will say.
Yeah.
Then we'll teach them, we will go through that, and then we will help them so that the parents may help the kid make decision so they own that decision.
Right.
And eventually what goes on is a consequence of that decision that they're taking.
Yep.
But it's not like a punishment.
Yep.
You're helping them, and the kid can feel the power of what he's being decided. So there's components of, first and foremost, being able to be aware what's going on with you as a parent. Is this decision that you're taking based on a moment of peace, or is it you were in a moment of anger, you were in a moment of frustration?
Yep.
How much are you teaching your kid? Because if you're like, but son, I've told you, stay calm.
Yeah.
You might try to teach him whatever you want. That kid is picking it up. That the one that screams louder or makes them more is who's winning.
Right.
And then there's parenting styles as well. There's parents that are really verbose, like, I cannot give you Coke because that's so bad, but you know that I do love you, right? Because it's not that I don't love you, and blah, and blah, and blah. And sometimes, teaching your kids limits is just as important as giving them breakfast.
For sure. 100%. There's a really good book that me and my wife both read. It's called Parenting Towards the Kingdom, and it's about parenting with a long-term, looking at it through a long-term lens of you're parenting them to move towards something, not just adapting to whatever's happening right at that time or whatever they want at that time, but even things of like, let's say a kid's riding a bike and they fall and they're crying, well, not running over and just picking them up, letting them pick themselves up, letting them learn to self-regulate, letting them learn to get up on their own and do, but that's like a skill that they need to learn. But if we interfere as a parent over and over again, they don't learn those skills, right? So
absolutely. And it's so hard because you might have all the skills you want, but when it's happening to your kid and your own homes, that all goes away, you know? And eventually, I love the phrase, you cannot change what you cannot see.
Yep.
So if someone is not helping you with their eyes, seeing your parenting strategies, seeing the things that you're done, you'll always think you're doing your best.
Right.
And you're doing it from love.
Yeah.
But sometimes you don't realize. So have your team back up with you and see what we're working on as parents be the same that you guys are working. So everybody's working on the same page. And if we're working on self-regulation, what do I need to support my kid? Eventually, he's getting a tantrum at the supermarket, but I'm there to help him regulate.
Yeah.
And I don't care what the cashier thinks.
Right. For sure.
But sometimes I got to go to a meeting and it's not time to work on self-regulation. I'll just pick him up and we will go.
Yep.
You know what I mean? So when you have that clarity, when you have that peace, then you start making good decisions for you and for your kids.
Yeah. Good long-term decisions.
Yep. And what I've realized is what is most difficult for me with my kid is the thing I struggle with myself.
Yeah.
So that's really related. So that's one of the biggest thing I think that we do, and it's true for every kid, but it's even more true with kids with special needs.
Yeah.
You know what I mean?
Oh, for sure. You know, like I've told this to a lot of my followers. Like my son, he had pandas, and when he gets into one of those flares where he's, now we don't see it nearly as much, where he's screaming, and you don't realize, as a parent, your heart rate starts going up. You get into a fight or flight response, and luckily as an adult, most people have the ability to self-regulate that and to stay calm in that environment, where a kid doesn't have that. But it's, even as an adult, it's hard. And there's not only you have to maintain that regulation, but you have to also help your kid get regulated, and that's hard. And you fail a lot. I failed many times, and it's you want to lose it, but it's all about growing yourself too. And I'm a lot better at it now than I was before. My wife's way better at it than I am, but it's a skill, just like anything else. It's something you have to learn as a parent, which is very challenging.
Absolutely, and I agree with you. And one of the things that helped me was my experience in sports.
Yeah,
because you need to be aware of both your body, your emotions, to be able to know, where am I, what kind of decisions are available to me right now, and which ones are not. And as you said, you will iterate, and you'll lose, you'll stumble, you'll realize, you will try it again, and eventually you'll get better at it.
Yeah.
But that's the way you can do it. But if you are not even aware that you can look from out.
Third person.
Person. What's going on? How are you doing it? There's no way you can be aware of it. You cannot change what you cannot see.
Right.
Absolutely.
For sure. And we see this as well with a lot of our patients, of parents with maybe the kid comes in with extreme anxiety, but the parents also have extreme anxiety, and what's learned versus what is what's seen every day and becomes a learned habit versus what is a true neurological issue is two different things, and a lot of times they come hand in hand, but it is quite interesting. A lot of times you see a lot of these challenges in both of them.
Yeah, and I think that on that point, you guys have a really important role to play, which is guiding the parents towards what is being a capacity component and what is eventually behavior.
Yeah.
So when you guys can test, for example, those reflexes and see where he is, you can help those parents say, okay, now this behavior that he's going, he's able to manage it, and if he's not, it's behavior. And that's what your parents have a role and stuff like that. So for us parents, it's really important to know and to have that guidance.
Right. Yeah.
From experts,
Yeah, to go off of that, that is an important point that you don't think about much of. Like, let's say a kid comes in with a moral reflex, like they have a true neurological reflex is triggering a fight or flight response. They can't control that at that point, but once it's gone, they have the ability to start to regulate, and teaching them how to do that as a parent is vitally important at that point. But prior to it, there's there's very little you can do when they're in that response, and it's just everything's going haywire. But once they get past that, they really do have to. That's a great point. They really have to relearn of how to teach them. For where their brain currently is.
Yeah, exactly, and that's a major point. So, for example, you guys have the possibility of showing them that on an objective level.
Yeah.
And telling them, now, guys, the ball is on your side.
Yeah.
It's part of your job. Before that, it would be almost unfair to demand that from the kid.
For sure. 100%.
And now, you have to demand of them, because otherwise you're not helping him develop. And we have the same thing. So we got the EEG to show us, for example, how is that alpha wave on the frontal part of the brain, which will be responsible for this self-regulations and stuff.
Yeah.
And now that we have it, we can tell them, okay, you can work on that, and now it's behavior or not.
Yep, they have the skill. There's the brain activating. Now they need to learn the skill.
Exactly.
Yes.
Exactly, and that's for me as a parent. It's something that helps you be like, okay, now we have a plan. Now I know where we're standing, and I know what I have to do. Yeah. And most of the parents, that's what we're looking for. The feeling is a really of loneliness.
Yeah.
The feeling at the beginning is a lot of uncertainty, like, what do I do?
Yeah.
What can I expect?
What route do I go?
What route? what expectations can I have for him towards the future?
Yeah.
And once you have someone with the expertise that can tell you, here's where we are, here's what we can expect of them, here we're not ready yet.
Yep.
And then when we move to the next level, this is something we have to demand of him now.
Yeah.
That's really, as a parent, okay, let's go with this next step.
Yeah. Yeah. It gives you a roadmap, gives
Yeah.
you a route, which, you're 100% right, is most people that we talk to on the phone console or wherever it is, they don't know where to start. They don't even know where the road is. They don't know what the route is to really help their kid and make a dramatic difference for them, and how to progress along that, for sure.
Yeah.
Which is, I don't know the words, but that's something that I feel as a provider that it's something we all need to learn how to help parents do, and as more research comes out, and as you get more clinical skills as well, and understanding where they are neurologically and developmentally, that's something that I know we need to work on as well as a team of just bringing that. So maybe we should do some kind of training over that. That would be very beneficial. I'd love to learn how you guys implemented that at the beginning and started that, because that's a very important point.
I'll tell you that it's because we went through that road before, that we know how to. And also we in Chile are starting a foundation to get that community together.
Yeah.
Because a big part of that support is being able to even talk to a person that is going through that. Because many people will say, you should do this, you should do that. But eventually they're not on your shoes. They're not living what you're living. And having that support from other families is great. And the other thing is they point towards the experts. This worked for me, this didn't work. And once you have your team, you got to trust your team.
Yeah.
I learned that in sports as well. If I have my technical director, he'll teach me the skills. If I had my physical trainer, he'll get my body strong.
Yep.
But also, if I have a good doctor and I crash on the course, he'll get me back soon.
Yeah.
So I trust my team.
Yep.
And that's what we need from parents as well. So, okay, you'll have the team. Maybe it will be headed by some of the doctors, and the other ones will join in.
Yeah.
But we need you to find your team
100%.
so that we get that team going. And once we have the direction, hey, let's pile up all in that direction so we can move that kid forward.
Yeah.
And you do your part as parents. For example, when we had ski racing, some of the parents would be on the slope, like almost getting on the stage. It's like when your kid is on the play, you're not on stage with him like, now you have to say this.
Yeah.
You're looking at him from the spectators, and when he goes out, you say, I saw your face. I saw you had a great time with that. That was amazing.
Yeah.
So that's the same thing that we need to remember those parents. What's your role in this? Where do I need you?
Right. For sure.
And once they have that, they'll get great. So one of the things that I imagine as I saw your face, like thinking, how can we get that, is maybe making sure that family has a team.
Yeah.
That would be the first thing.
Yeah, for sure. Great point. Making sure that in everyone's, their primary and their OTs and their PTs and all that from a physical rehab standpoint, which is primarily what we're doing here, is all looking at it through the same lens and in the right direction. And, if we're working on primitive reflexes, well, maybe we shouldn't be jumping ahead and working on some of these things. Maybe we should all be focused on starting this process off right.
Yeah.
For sure.
Yeah. Maybe one of the things that I think are really powerful about parenting and learning in general is having that collective learning.
Yeah.
Collective learning is much deeper on an emotional level.
Yeah.
So I used to alpine race, right?
Yep.
And I would struggle on my own and I would celebrate on my own. And then when I finished my skiing career, I started playing soccer a little bit. And then we won a little championship with some friends. The celebration of that championship was even bigger than my celebration on getting to the Olympics,
Yeah.
And what I've learned also is when I'm working with other parents, looking at what they're going through, looking at what they are seeing in my case, that learning, it's much more deeper. It's stronger.
Yep. Oh,
so,
for sure.
so in this road, don't be afraid of sharing with other parents and families, because your process is going to be much more powerful.
Yeah.
So on parenting, that's the other thing. It's not about me learning how to do it for my kid. First of all, you got to take the kid out of the equation and focus on it's me that I'm working on.
Yep.
Okay. And I need to do this for me, and it will work for my kid.
Yep.
And the other thing is get into opening with other people, because when you learn as a group, the emotional side of it is much more powerful, and the deepness that you will be able to get is better.
Yeah, it's just like any community, you're gonna learn. If you have a group of people, you're gonna learn at a much higher rate, and that's we see that with even our own doctors. We're all constantly learning, and we're all learning at a much faster rate because we're able to share that with each other. We're able to link things together. Many brains are a lot better than one, for sure.
Yeah.
From that aspect, yeah. And when it comes to parents, it is unreal what a lot of these parents that have kids that have developmental challenges, they know more than almost most of the doctors that I talk to by far.
Yeah.
It's crazy how intelligent a lot of them are, and how well read a lot of them are to help their kids. And so not taking that for granted of like, if you're in that scenario, you probably know more than the provider that's sitting across from you in a lot of cases.
Yeah. And you know what that is? It's because you got skin in the game.
Oh, for sure.
You got skin in the game.
Yeah, you have a reason.
Exactly. And this is the same thing as when you have a pilot and he's piloting the plane, he's going to do it right, because if he crashes, he'll go down with you,
Yeah.
And that's something that feels kind of hard for parents, is that sometimes the attitude that we see from the medical side is keeping the distance to have a correct setting, okay? The medical setting is important because you need the patient to listen to the doctor and to make what the doctor recommends.
Yep.
We agree with that. But sometimes we as parents feel such a distance, such a lack of empathy, such a lack of opening towards learning new stuff, because they don't have the skin in the game.
Yeah.
It's not their kid that is struggling.
For sure.
It's not their kid that has got a time window to get.
Yep. Oh, yeah.
So if they're like, yeah, well, maybe I'll wait for 200 more papers to come on this, and I'll check out how the research is going on. Dude, you owe this to these kids.
Yeah.
Start looking at the research, start seeing what's working, start talking to parents, and maybe they're willing in that interaction to move this forward.
Yep.
We don't know many of the things, but we need to address them now. It's going really big. It's going to affect lots of people, because if you look at the statistics that you've mentioned in many of the videos, you will have kids with developmental delays or spectrum pretty close in much of the classrooms around the world.
Yeah. Oh, yeah. Yeah.
And many of the things that we're looking with these kids, you can also have a hand with your kid that is neurotypical. But hey, we need that team working with parents, getting involved with the science world, with the doctors, and with everyone, so that we can move this forward much faster and much more efficient.
Yeah. And there's obviously a lot of unknowns when it comes to autism, but there's also a lot of great research out there that is known, and there's a lot of therapies that are known to affect those aspects. And and that's our goal, is and same with yours, is taking those therapies that have good solid research, and maybe some of them do need another 10 years of research to get a really solid protocol and programs and XYZ, but there's kids that are struggling now, and there is good research for a lot of these therapeutics to be used, or a lot of these nutritional aspects, or a lot of these dietary protocols or lifestyle medicine stuff to be used for this population based off the underlying mechanisms that are going on. And that's something that kills me, is like, someone will go to their primary and they'll go, oh yeah, well, photobiomodulation, that's, that can't work. Well, there's like 14,000 studies that say it does, and when it comes to autism, there's lots for autism and for underlying mechanism of autism and how it directly affects that, lots, and like good research. And so a lot of times it's just that they haven't even looked into it.
Absolutely.
And same with transcranial magnetic stimulation.
Absolutely.
There's tons of awesome research out there.
Yeah, I agree with you. And eventually what I see is they're more afraid of getting themselves burned by being looked at someone who's backing up something that still is on the road to getting all that evidence that we would all love to have.
Yeah.
But what eventually happens is they start getting our patients, and then they call us and they're like, okay, can we talk? It would be interesting, to know what you guys are doing. But guys, I mean, why I decided to open up the Brain Treatment Center in Chile is because I know the difference that we can make, and I know that I owe this to the parents to know, at least they have to know, this exists, this is the evidence that is behind. You make now your decisions, but not based on there's nothing you can do.
Right.
We went to some doctors that said, hey, your son is on the spectrum, he will not have friends, he will like video games, and there's nothing you can do. And I'm like, come on, this cannot be your answer. So that's the role that I want to do. I want parents to have, okay, these are the possibilities. I'll tell you what you can expect, what you cannot expect, and then you can take a decision. Yeah. And you can do what you prefer to do with your kid, but based on the possibilities you have, the freedom that you have to take those choices. Yep.
They have the knowledge they need. They have the understanding they need to make an appropriate decision versus no one explaining anything to them.
Exactly.
And going, yeah, nothing. It's that kills me. Just kills me when a parent comes and says, yeah, I went here and they said nothing could, or do a phone consult. Oh yeah, their doctor says nothing can be done here or there or whatever it may be. And it's like, well, there's a lot of research that says that person's wrong. Yeah. So maybe we try something and see how they respond. And then if that doesn't work, maybe we try a different thing and see how they respond to it. And at least try things that are safe and effective and been shown to be safe and effective for years, and try to actually make a change, which, now there's a lot of things out there that can make a dramatic change. And you see that every day. I see that every day. And it's only getting better too, if they're willing to try things.
Yeah, absolutely. Absolutely. And that's what's warming our hearts and going through it, talking to parents and having them, hey, he called me dad or mom for the first time, or we went to a restaurant with other people, or he's playing with his sister and everything, and you're like, that's great. Or now he's being able to focus at school, and you did a huge change for that family. And that what gets her going on and having that energy of, we want to share so that people can make their decisions.
100%. 100%. That's so important. And I tell us that our doctors all the time is like, when a kid comes in, the parents, or especially like doctors that are just starting this work, is like, they're not expecting a miracle. They just want improvements. They want they want a roadmap. They want to head in the right direction. And when you can do that, and their kid can improve by 20, 30%, and now they can go out to eat, and now they're communicating, whether that's verbally or non-verbally more appropriately, they're interacting with siblings more appropriately, they're realizing other people are there, like that changes their life forever going forward. And those results continue to get better and better as the child matures as well. But like, just a 10% improvement's a huge improvement. And, if you can get 100%, awesome. But just getting them in the right directions is a fantastic place for them to start.
Yeah, I know. And that's the message that I'm staying with, is that hope and that possibility. And when I see parents, usually I look at the parents and I say, okay, this kid's going to be okay, because of what they're doing, of the attitude they have, of how proactive they're being, how disciplined they are, how they're helping with each other and stuff like that. And we know that the kids progress. So that's one of the messages that I want to send, just as a parent and also as a provider. We have seen technology. I've seen with other parents different things, and that's why we came here to see you guys as well, and to be able to work together and to share the knowledge is also something that is going to move it faster and forward and higher. And that's something that inspires me.
Yeah, for sure. And I think you said something crazy important there, is because we see the same thing, is the mindset of the parent, I think, is one of the biggest determining factors of what happens for that kid. Because the mindset of, my kid is going to get better and I'm going to figure it out. And I'm not saying just coming to us, because there's so many great things out there, right? But, these parents have done so many different things that have moved the needle every single time. And that kid, every time that needle gets moved, gets better and better. And now they can learn more and learn more. And I truly think that is one of the biggest determining factors of how well a child progresses, is simply the mindset of the parent of, rather than taking that, oh, my kid's never going to improve, versus, my kid is going to improve and I'm going to figure it out. I don't know how right now, but I'm going to figure it out and I'm going to work towards that. I by far see that being one of the biggest impacts in care that we give, and those kids that get those massive changes.
Yeah.
It's a lot of times it's the mindset of the parent and the mindset that parent puts into the child.
Yeah, I agree.
Yeah.
Absolutely.
For sure. Okay, so we talked about a lot of fun stuff. Tell me about MeRT. Tell me how it works. Tell me about the changes that you see in the patients that you guys see in your clinics. Let's start there. That'd be fun to talk about.
Yeah, perfect. So MeRT is based on transcranial magnetic stimulation, and we do it guided by an EEG. The EEG will give us the actual frequency of the alpha wave. The alpha wave is the wave that is responsible for the sensing, and it will also act as a director for the rest of the waves, the brain waves. And the alpha wave for a person will go from 11 hertz to 13 hertz. So for a kid, it could be closer to 8 hertz. For you, it might be 10, and for some other person, 12 hertz. The importance is that when we manage to stimulate at that frequency, we will manage to get into resonance. When we get into resonance, the amplitude of that wave will increase significantly.
Okay.
So what we have found is that when you adapt the stimulation frequency to the natural alpha synchronized frequency, what we call the intrinsic alpha frequency, the results that we get are much higher. And that has been really interesting to relate to the other process that we go in life as well. But for example, what we've done also is modulation with strobe light.
Yep.
And when you get that strobe light at the same frequency, at that brainwave, the results are even greater.
Cool.
So that was super interesting to know and to see, for example, for Noah, when you guys are working with the laser and you're pulsing
Yep.
and you're using alpha,
Yep.
okay, but then something light up and says, what alpha frequency are we using?
Yeah.
Are we using 10 hertz? Because I know the exact frequency of Noah, and we could set it up,
Yeah.
and maybe we'll have even greater results.
I can show you how to program that in the laser.
Exactly. So I'm excited to bring it home, to be able to help Noah, to be able to help some more patients.
Yeah.
Because then we start using all of that so that amplitude increases and we have better and better results.
For sure.
So that's one of the concepts that I think is really interesting to understand. For me, it makes a big sense as an engineer, like resonance. Like if we are in a stadium and we're all jumping, everything is smooth. But if we jump at the same time, the amplitude of that wave will be so big that eventually the stadium will crash down.
Right.
Because of how strong it is,
Yep.
And in that sense, if we manage to synchronize those frequencies, we will get a much more powerful result. So that's one of the things that I wanted to mention, and we've been working on, both on our MeRT clinic, but also with the different other things that we're working on, and that I thought maybe this is some kind of a little bit of a suggestion that we can give you guys at here, that we can complement that. If we have the EEG, we can maybe even laser to that exact frequency.
Yeah.
Maybe it will help. I think that's an area of
investigation
work to do.
for sure.
Yeah.
One question I have, interestingly enough, is as their brain matures, does that frequency change?
Absolutely.
So in what direction does that change?
So usually when we're growing up, just as a natural process, the alpha wave will speed up.
Mm-hmm.
And
Yep.
then as we grow old, it will slow down.
As the brain degenerates.
Exactly. So it's normal for the brain waves to change in time, your own brain wave. Okay?
Yeah.
And then there are different brains. So there are brain waves that are faster and the other ones are just naturally slower.
Yep.
That's normal. And what we've seen, even with patients that are working with us, we've seen differences in speed of 1 hertz.
Right.
That's huge.
Yeah.
That's really big. And so as we are moving forward, eventually it's dynamic. It's not like, oh, I did the EEG for my son 10 years ago and it was 11.5 hertz.
Yeah.
No, it's dynamic. And we can see. And what's interesting also is that, let's see, for example, a patient that came in for a TBI, traumatic brain injury, and then he's got a disruption in his frontal lobe. And we managed to get that back, and he's doing really, really fine. But eventually, 5 years down the road, he had an emotional difficulty. Someone passed away, or he finished up a relationship, and he's not able to get back. we can see it on the EEG and say,
Yep.
yep, you're right. It did affect you. We can
Yeah.
give you another hand. So it gives you also that objective side to say, okay, can we help in this case? Can we not? And
Yeah.
what do we need?
Yeah.
So that's pretty
Oh,
cool.
yeah. I mean, just stress alone, that'll inhibit your frontal lobes and it'll dysregulate that whole system. So super cool. Let's talk about changes that you commonly see in kids that have autism, because I know that's going to be a question that every parent's like, well, oh, that's really cool, but what does it change in my life? And I know you can
Yeah.
even explain about your son and how it changed your guys' life and stuff like that by specifically doing this, by doing MeRT.
So I'm going to talk to you in general, and then I'm going to give some examples.
Yep,
So in
perfect.
general, what we usually see is an improvement of the occipital part. So as you know, the brainwave will first develop occipitally, then will go centrally, and then will go frontally.
Yep.
Typically, what we see is that we can see at the beginning, all of the synchronized waves will increase. So if he has a theta synchronized wave, typically the theta will increase, and then it will move on. But typically, what we see at the beginning is an improvement in occipital. So it will be visual processing, eye contact, the fact that they are able to maintain concentration for a little longer. And then as we move forward, we might see improvements in the sensory capacity, for example, trying new stuff, trying new foods, and so on. And as we move forward and we see the development of alpha in frontal, usually what we see is better focus and concentration, better language and processing. We see better mood regulation, and we see better sleep. So 80% of the patients that come to us, whether it's autism or not, will report an improvement in sleep when they had problems in sleep. And people see sleep just like an off stage, like we're off.
It's our main healing stage in
and
development.
It's super important. And one of the biggest things I would say that MeRT does is by helping you regulate the alpha waves, it'll help you regulate your sleep, and then really great things happen. You know what you've talked about, the lymphatic system and so on. And so it's really important about that, and it's really important about brains are so different, and some people have high beta, which will give them the drive and the energy to go. But if you don't have that alpha wave that will help regulate that, you will fall into anxiety. Right? So alpha will help you with that. And typically with children, it will depend on where they started, what stage they're in. But that's the things, most of the parents that comes in, they tell us, we see he's more connected. He's more aware of what's going on. Some patients came into us and their expectancy, how do you say that? It was for them to talk. Most of them will say, hey, what will be a game changer and what we would like to see is for them to talk. And we've seen patients that have said their first words with us at the clinic. We've seen patients that had little words. Now they have a YouTube channel, like the hummingbirds will come from the forest in Canada, and we're like, awesome. And we have patients that are not speaking much, but they're bubbling much more. They're being able to do 45 seconds of eye contact. They're being able to maintain concentration for 45 minutes for their speech sessions. They're not having dysregulations, and they're sleeping all night. And sometimes those are precursors so that they can keep on moving forward. And what I say, parents, is some of the things you will see in our clinic right away, and some others, because your brain is in a different state, that will allow all of the other stimulations that you're doing to have an impact and to flourish. So the analogy I use is you're trying to make a plant grow in the desert. And every day you'll plant that seed and you'll put some water on it. But the terrain on which you're doing it is not prepared to take advantage of that full stimulation. And now, for example, Noah's therapist would say, wow, what did you do with Noah? I'm like, he's had great improvements. He's still a kid in the spectrum. Yeah, but what took us 4 weeks to work with him, we did in 2 sessions. Okay? So some of the things that you said will be a baseline for him to be able to move forward on that. And some of the changes we see are those. And some are very clear for parents. For example, when they see improvement in speech, I think that's huge for parents whose parents are not, the kid is not speaking. It's a big dream for every one
for sure.
parents in that state. and some of the kids do, but we cannot progress them. So
Yeah.
our biggest work at the Brain Treatment Center, the therapy works. It's
Yeah.
about expectation management,
Yeah,
you
for
know,
sure.
because we cannot say in advance how the kid is going to progress. What's interesting though is we can see with the parents, both clinically and on the EEG side.
Yeah. These
And-
things are starting to, as the EEG changes,
Yeah.
these things are starting to
Yeah.
change. Yeah.
So we can guide them like, okay, we're seeing an improvement in occipital, so he should be able to process better visually. And they're like, oh, you're right. Before that, he will like stumble on all the toys and on everyone, and now he's not. Oh, okay. Now I can know and I
Yep.
can see that how that is going on. So yeah.
Yep. That's cool. That's awesome. Yeah, I mean, I've been hearing about MeRT for, I feel like, I don't know if it's, I know it's not super new, but I think on social media it kind of took off. I don't know if, but you know, prior to maybe a year and a half or 2 years ago, I had never even heard of it.
Mhm.
But it's been really cool to see and start to read some of the studies that, you know, transcranial magnetic stimulation is doing. But and I think it's an exciting new avenue as well for a lot of families, because I've seen a lot of kids that have done it as well and done really well with it. So
Yeah.
that's
Yeah,
really
yeah,
cool.
yeah. No, I've seen it in my kid, and we've done it different times. So my son Noah, he's got progresses that are really going like that. But
Yeah.
every time I'm seeing it progress.
Yeah.
And the kids that we've seen, I've seen them all progress. What I cannot assure is it's gonna be
when-
at the level that you have of expectancy as a parent.
Yep.
You
Yep.
know, but that we've seen improvements. We see them, and you can see them also both clinically and on the EEG.
Yeah.
And it's part, and I always say to the parents, so you finished MeRT. Now it's time to work all you can do on this, you know,
Yeah.
both on your parenting, but also on the rest of the therapies, because now we got a brain that is ready for it.
Yeah, exactly. So
let's
at
go
a whole
for it.
new level.
Yeah.
Yeah,
Yeah.
for sure. Okay, so to wrap things up, let's say, you know, someone down in Chile sees this. Where can they find you? Give us your social medias, your handles, stuff like that, so they can follow you guys. I know you guys have a starting to get a larger following as well on, I think I saw it on Instagram, but give them a rundown where they can find you and learn a little bit more.
Yeah, so our webpage is braintreatmentcenter.cl, braintreatmentcenter.cl. I'll say it in Spanish as
Yeah,
well
there you
for
go.
some of them that listen to it. On our Instagram, we're btc.chile. And there it's going to direct you to our WhatsApp, and then we will answer. You'll probably get on a Zoom with me, and I can explain all of that once I get to know your case, and I'll guide you both with our experience for Brain Treatment Center, but also my road as a parent. And that's been something really rich, you know,
Yeah.
being able to talk to other parents and to give them a learning curve that is not as difficult as maybe some other parents we've seen. So
Yeah.
really looking forward to that. So thank you for the opportunity. It has been some great 2 weeks, and I'm sure we're going to continue to work together really well.
Yes, for sure. Hopefully we can help some parents find you guys and help get some resources as well alongside. Maybe they've already seen us. Maybe they're looking for someone local to them. But be ready. You're gonna get people reaching out and asking if you know anyone here or there, or what's your experience here. But hopefully you can help a lot of those patients as well. With you just have a different experience than I have, and you know, because I don't have a child that has autism. Your experience is going to be able to help a lot of people where I couldn't. So hopefully this gives them a route to get to you.
Thank you so much.
You're welcome. Awesome. Thanks, man.